Well, we are back with our sponsor today, Dr. Rhys Branman of the Cosmetic Surgery Center, here to talk a little bit about a non-opioid pain control option, because I know doctors are looking at this with the crisis that we have in this country.
There is a big crisis out there, and it's really all about pain control. For so long, we've not wanted to have any pain, and that's reasonable. I think people should reduce the amount of pain that they have during surgery, and one of the go-tos was opioids. The problem is it sort of created a problem. We now have 91 people every day dying from opioid use or abuse. And it's a crisis now. It's reached epic proportions. Even here in Arkansas, our governor's doing a great job of really addressing this problem.
Local and national level.
Local and national. And so we have, approximately 240 million prescriptions are written every year for opioids. I mean, that's a lot of prescriptions. So it is an issue. And so everybody's looking at ways of controlling this problem. And one of the newest things that's out there is called Expirol, which I use in a post-surgical setting where we're trying to control pain. And what this is this is an injection that's given in the area that we did the surgery. And it gives patients 72 hours of pain relief. Which really gets people over the crisis, the hump.
Those hard days.
Those hard days, those first 2 days or so where, the pain is more intense. We can actually control it right from the point where they wake up from surgery for 72 hours, and then they can then transition to less opioids or just a non-steroidal anti-inflammatory or something like Tylenol.
Advil, Tylenol.
Advil, Tylenol. And so that is the goal here, and it's working really well.
So doctors are looking at ways to cut back then on the
They are looking at ways of cutting back, limiting the amount of opioids that we're giving. And this is just a very nice product that's out there that we're using in many of our abdominoplasties and our breast lifts. And, even oral surgeons are using this, OB-GYNs. And so it's really becoming more popular, and it's a really great way of combating this issue.
And especially if you have a patient who says, look, I've had a problem with this, I have been, maybe I've come through it. They don't want that kind of a drug.
No, they don't want that kind of a drug, and it puts them at more of a risk. Probably 1 in 15 patients are at risk of becoming opioid users or abusers after they've had a surgical procedure, and that's a high statistic. And so we're trying to prevent that. If we can limit the amount of opioids used to maybe a 2 or 3 day period in the immediate post-surgical period, then you don't have that risk.
It sounds easier as the patient because you're doing this before I leave.
I'm doing it.
I don't have to worry about
It's a great technology. The Expirol uses what we call liposomal technology, where the drug is packaged in little fat cells, so to speak. And then over time, that medication is released into the body. So that's why you get this nice long-term kind of pain relief.
Which of your procedures can it be used for?
Oh, it's pretty
much.
All of
them?
Well, not quite all of them, but I would say most of them. All the big body procedures, like tummy tucks, breast augmentation it can be used for. It can be used for breast lifts and mastopexies. So it can really be used for many of these procedures. And some of these patients are new patients, meaning this is the first time. And if we can limit their exposure to opioids, all the better.
And I know you have older people, but you have a lot of young women especially who are coming to try to look and feel better.
That's right.
And that's a group that we have seen with this addiction. So.
And it's interesting because even our older patients, you don't want to expose them to large amounts of opioids because they can't handle it as well. They can get very sleepy, they can fall and hurt themselves, and so we are really on the forefront, the cutting edge of limiting the amount of opioids, but still retaining that pain control that patients require after surgery.
Because you want to make sure they're comfortable. You don't want them suffering when they go home.
No, we want them all comfortable, because the more comfortable they are, the more they're going to get up and walk around, the quicker they're going to heal, and I think Expirol really does a great job of doing that.
Another good thing, it's not sitting there in the medicine cabinet for months and months later, and we're hearing that's where a lot of young people are finding it.
That's
so, we're keeping it out of the home as well. So you should ask your doctor. Of course, Dr. Rhys can tell you about it, but really any doctor you could ask about
Any doctor you can ask about. We have it at the Cosmetic Surgery Center. We use it routinely because that's what really makes the big difference in postoperative healing and pain control.
Yeah, always looking for ways to make the experience better.
Absolutely.
I know you are. So let's put up the information, of course, about the Cosmetic Surgery Center. And, of course, we've talked about the spa and the skin and
we've
everything.
Talked about all that.
Yes.
And now it's going to be pain control, too.
Okay, very good. Always something new there, and thank you for, keeping us up to date on all of that. Give them a call or go to their website. It's fantastic with all the pictures there before and afters, and that will explain all the services that they provide. Thank you, Doctor.
Thank you.
Appreciate it.
Appreciate you.
Happy Memorial Day.
Thank you very much.
Back in just a moment over into the kitchen. It's apple